So as a nephrologist, obviously I am biased. I would say that the kidney is the most important organ in the body. So a kidney is important to maintain a sense of balance within the body, or we call it homeostasis. So excess of anything is gotten rid from the urine by the kidney, and if you're running short of something in the blood, it's conserved by the kidney. So I would say that it maintains a sense of balance. So imagine your kidney as a filter, a tea filter, right? So it is supposed to filter out all the waste products from your blood through the filter, and all the waste products usually comes out through your urine. So imagine your kidney to be a factory. So urine is a byproduct, all the waste product comes, and I would say the product that your factory is manufacturing is your general well-being, or a sense of balance within the body. So coming to the prevalence of kidney disease in our country, about 2 lakh patients are being diagnosed with end-stage kidney disease every year in our country. Out of these, 2/3 of the patients don't even have the facilities or don't even get dialysis. And of the patients, the 1/3 of the patients who do get dialysis, 10% of them die within the first year. So this is a huge number, huge burden in our country. And out of the 1/3 of patients who require dialysis, I would say that at least 50% of them don't get dialysis because of the shortage of dialysis machines or nephrologists in our country. Early on in kidney disease, a patient usually doesn't have any symptoms, or they have very vague symptoms like weakness, lethargy, loss of appetite. As the kidney disease progresses to say stage 4 or stage 5, they start manifesting symptoms such as decreased urine, swelling of the body, swelling of the feet, frothing of urine, maybe uncontrolled hypertension, weight loss, nausea, vomiting, breathlessness. So all these symptoms usually manifest very late. The most common cause of kidney failure in our country is diabetes, followed by hypertension. And apart from that, there can be other causes of kidney failure, like using over-the-counter painkillers, using herbal medicines, genetic factors, or anatomical factors or congenital birth defects that can cause kidney failure. Apart from this, obesity, a very lethargic lifestyle, sedentary lifestyle is also adding to the kidney, the cause of kidney failure in our country. So for all patients who have diabetes, hypertension, one would be to keep a very strict control on both hypertension and diabetes. And if you have it, I would recommend a yearly or annual screening of your kidney, that is to do a serum creatinine at least once a year, to get a urine examination to see if there is any protein leakage in your urine, which is an early, I would say, an early symptom of kidney failure. And third is to watch out for symptoms, and if you have any of the symptoms that I mentioned, to meet a nephrologist. Dialysis is basically a machine which functions, or it replaces kidney function. So it is an external filter. So whatever the kidney needs to do, the machine does it. So your blood comes out through your body via a tube, which is connected to your body with a needle. The blood comes out, it passes by a filter. The filter cleans out all the waste products, it removes the excess fluid, and the clean blood goes back to your kidney. This is called as dialysis. Dialysis is generally recommended to patients when the kidney function is less than 15%. So when the kidney function is this low, they start having symptoms, so the kidney is unable to bring out the excessive amount of fluid from your body. The other thing is called as a peritoneal dialysis. So everybody has a lining in the abdomen called as peritoneum. So we can use this as a biological filter. So what we do is we put a needle into we put a tube into the abdomen. We try to fill in some fluid. We allow the fluid to remain in the abdomen for 6 hours. So all the waste product diffuse into this fluid, and then we drain it out. So this is called as peritoneal dialysis. This is the other type of dialysis. This allows more freedom to the patient, in the sense that the patient doesn't need to come to the hospital every other day for dialysis. This can be done at home. The patient can do it himself. And patients who live very far off from healthcare settings can do this at their home. So this is the advantage over hemodialysis. The dialysis, especially in patients who have chronic or permanent kidney damage, is a ongoing thing. So it has to be done till the patient is alive. So this is a lot of financial burden or economic stress on the family. So each patient on dialysis has to spend at least 3 to 4 lakhs per annum. So that is a lot of money for patients who come from poor economic backgrounds. So that is, I would say, the biggest burden on the family. So the challenges in dialysis is basically that obviously it is a long procedure. Even peritoneal dialysis or hemodialysis, the patient has to do it for a certain amount of hours every day or every other day, and most of the times the patient is having to come to the hospital. So one is the cost of coming to the hospital, going back, the cost of dialysis itself. So every time you introduce a needle or a tubing into the patient, they are prone to infections. The best thing you can do for your kidney is screen. So early detection, early prevention, because once your kidneys are injured or there is permanent damage, there's nothing you can do for the lost kidney function. So prevention is key. So I would recommend everybody who even if you have the slightest doubt that you may have some sort of a kidney damage, to get it screened. And if you have questions, you can always meet your physician or your nephrologist to see what you can do best to keep your kidneys healthy.